The effects of the outbreak of COVID-19 has led the outbreak of new variants called Omicron. This has been revealed by Dr. Lou Riek from African Center for Disease Control and Prevention in the cross-border cafe, which brought together journalists from different countries. According to Dr. Lou, the lockdown, poor health facilities, inaccessible of health care, among others, are the reasons behind the coming of Omicron.
We have seen prevalence of mental health and social health issues, among others. At this point, I would like also to emphasize that this meeting comes at the time when the Africa access to the most important life-saving vaccines has been totally unequal, insufficient, unfair. Sadly, the lack of access of these life-saving vaccines have caused preventable and unnecessary death. Also has created a perfect opportunity, perfect environment for the new variant to emerge, including Omicron.
He further highlighted the reasons behind Africa's state of vaccination as of now, about 60%, according to him, but it's not safe still in the fight against COVID-19.
One of the biggest obstacles is the lack of adequate vaccines in Africa. This is the biggest issue that's preventing the African to achieve herd immunity. Also, the issue related to the delivery of the vaccine doses that's deployed in Africa is a further obstacle that is affecting the little vaccine that we having.
He further urged the population to go for vaccination, but he doesn't commend governments to make it mandatory for their citizens to be vaccinated. It should be noted that Uganda's government promised to table a bill before Parliament which will make vaccination mandatory to any citizen.
Comorbidities, yes, this has been discussed and cleared with the World Health Organization, although other countries are vaccinating even other children with the Pfizer vaccine. Lastly, Right Honorable Speaker, next week I will be laying on table the Public Health Act that will cater for a number of issues you raised, including mandatory vaccination and also people who don't put on masks and don't follow.
This particular time in the movement are issues, yet like I spoke about it, it's not the hesitancy, not forcing of the people to be vaccinated. We don't have the sufficient amount of vaccine in most countries in Africa, with exception very few like Morocco, Seychelles, Mauritius, that has made it possible to reach 60% of the population that is targeted. But we really encourage each and every one of us to trust the government, to trust the World Health Organization, to trust the Africa CDC. Those organizations, they were formed for one.
Yes, Chigongo, Channel 44 Prime News.